Hello there, I'm Dr. Danielle Rose. I feel that Mike's analysis of the breathing and use of multiple techniques and exercises to help patients and clients develop a better pattern and give them the feedback to feel that pattern is exponentially helpful to their overall health. The patients and clients receive almost immediate feedback as to what a proper deep breath should look and feel like, and to begin to experience their bodies in a new, more relaxed way. If they do the breathing work long enough to be able to recognize when they fall back into poor patterns, they can make good forward progress on their healing journey. Mike has taught a man to fish rather than given him a fish, which is significantly more healing because of the inner empowerment that occurs for the patient. Moreover, he does it in a manner that produces absolutely minimal side effects, reactions, or interactions, unlike most pharmaceuticals. I highly recommend this video to those of you who are healthcare professionals and your staffs. As practitioners, you are already in the habit of taking your patients' respiratory rates with vital assessments, and this video will enable you to improve your skills exponentially. Knowing the basics of optimal breathing development will enable you to quickly assess and improve your patient's breathing and thus well-being, which will ultimately build trust in and compliance with your recommendations for their care. I personally had begun using some yoga breathing instruction in my practice for those whose breathing was backwards. I had long been bothered by the significant variation in patients' abilities to take a deep breath on exam, but was always taught that it was due to individual variation. Hindsight being 20/20, I now know their breathing mechanics were out of balance and needed some coaching to be put right. Mike's instruction has expanded my understanding so much more deeply, also giving me greater empowerment as a physician. It is my desire to help Mike find ways to get his teaching to other physicians and health practitioners as a first line of intervention for many chronic and stress-related diagnoses. I believe medical schools should begin incorporating Mike's techniques into their teaching of physical exams. Other allied health programs, particularly those in speech, physical, and respiratory therapies, would do well to include studies and practice of Mike's work.